Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas.
Hello, everybody. It's Tim Cranton from the College of Remote and Offshore Medicine. And today's podcast is going to be about continued professional development or continuing medical education. I've had a few people ask me about continued kind of medical education programs, and obviously the college does offer CPD courses, but then not everybody understands what CPD is or CME. There are various other terms that people use. So I wanted to make it a point of discussion today, so that you medical professionals out there have got an idea of expectations in terms of the bodies that we're registered with, and how we can stay up to date as medical professionals. Um, I'm going to entitle this Enhancing Medical Excellence Through Continued Professional Development and Reflective Practice. At least that's what I wrote in my notes. And I'm going to focus as well on reflective practice because it's a really useful tool for us when it comes to learning. And I'm going to be looking at kind of self-reflection. And that may be of something that you've done, something you've experienced. But again, I'll talk about that as I go through. So hopefully by the end of this, you're going to understand the significance of continued education, as well as reflective practice, that will help us maintain and improve, our skills and our patient care at the end of the day. So CME, continued medical education, and CPD, a continued professional development. CME is more of an American term, so you can get things like CME credits if you're doing courses in the US. And CPD is kind of a term we tend to use in the UK. Certainly for myself as a paramedic registered with the HCPC in the UK. And they are processes that involve ongoing learning, skill development, and knowledge enhancement for medical professionals like myself. And that's beyond our initial training. So again, you're already registered as a paramedic, or you're trained as a nurse or a doctor or whatever. And this is all training and education beyond that level. And certainly something that you will carry on for the rest of your career. I mean, for myself, being a paramedic, I've been doing this for over 35 years now. And I still see myself as a student. I'm currently enrolled in a master's. So, you never stop learning. And I think that's the thing to remember. As medical professionals, we never stop learning, or we should never stop learning. Of course, this also helps us to keep up to date with the latest advancements. Most certainly in medicine, there is so much information out there, as well as technology. So it might be, new pieces of equipment that you need to learn how to use and operate in order to be able to do your job and provide, treatments for your patients. Of course, there are going to be benefits of doing CME and CPD. And really, as I said, that's about your patients at the end of the day, and it's going to improve patient outcomes. And as I said, by enhancing medical knowledge and skills directly impacts patient care quality. Arguably, you know more about what you should be doing, and that's going to improve upon the level of care you're able to deliver to your patients. Of course, you're looking at professional growth as well. Some of us might want to be looking at promotion. Most certainly, if you were working in the ambulance service or something similar, you might want to enhance your skills and your knowledge to be able to, up a pay grade. So professional growth, it enables you to stay competent. It enables you to stay relevant, as well as adaptable in what we would, describe as a rapidly evolving field. Career advancement and CME and CPD, like I said, often contributes to promotions and specialization, especially in leadership roles. Importantly, I think, and again, I put this down in my notes, reduced medical errors. Unfortunately, in the world of medicine, a lot of mistakes are made because of a lack of knowledge and skill. Patients are not necessarily receiving the best level of treatment or the best interventions, because the medical practitioners that are looking after them um, don't have that level of knowledge to be able to refer them or offer them an appropriate medical treatment. Updated knowledge is going to lead to better informed decision making, and that's going to minimize errors. So, in terms of CME or CPD, there are various components that we should consider. So, you're looking at your formal education, and you're going to attend workshops, conferences, webinars, and other trade courses. I mean, this September, I'm going to be in Nottingham at Nottingham Hospitals Trust, and they run the offshore medics course, or the HSE offshore medics course in the UK. But every 3 years, myself and other offshore medics, we have to go back to um, Nottingham, and we have to do a offshore medic refresher course, and that's a 2-week course. So we have our basic offshore medic course, and then 3 years later, we're going to have to do a 2-week refresher. So that's going to be a trauma refresher. So we actually do the PHTLS from the NAEMT. We'll do the acute illness management. We'll do the UK Resus Council advanced cardiac life support course as well as part of that 2-week package. And that keeps us up to date. Obviously, there are going to be various changes in things like Resus Council guidelines that we need to make sure that we stay up to date with, as well as drugs that might be used in cardiac arrest type scenarios. So, as well as our formal education, we can have self-directed learning as well, and that can mean reading things like medical journals and research papers. Most certainly, before I did my paramedic degree and my masters, I really didn't read much in terms of books. I mean, I left the military, and obviously I did my offshore medic refresher, and I've had to do various courses, thereafter, which I did need to do some I say self-directed learning. It's more force-directed learning because you have to do it in order to pass the course. But this reading was done as a pre-course package that was sent so that the course or the time spent on course in a classroom is minimized, and obviously that saves money as well. But I, cannot emphasize enough that if you're not doing so already, get hold of some, good medical journal articles. Start getting on the internet, go and look through research papers, because they're a fantastic resource when it comes to self-directed learning. And you can record this, any paper that you read, or and take some notes on. You can make a log of it, and you can use that as evidence that you're continuing your education. Of course, clinical practice is an obvious one, and gaining practical experience and learning from patient interactions is really important. So it might be, again, like myself working offshore, we kind of have a restricted client base. And whilst we might have quite a large kind of age range, we're not really getting pediatric cases. We're not getting many obstetric cases. And whilst we've got a few, older people out there, not so many geriatric cases. So every now and then, I'll take myself into a clinical environment. And certainly for us at the college, we have the ability to go to Tanzania, to Kilimanjaro Christian Medical Center. And we offer that also to our students as well that are on our BSc and MSc programs. And that's a really good opportunity to be able to get some hands-on, different patients, different patient groups, so you can maintain your education, your skills, and your knowledge. Most recently, for me, as a scout leader here for British Scouting overseas in the Czech Republic, where I live, I just spent a week, 10 days on annual camp. So I've had a huge kind of pediatric patient group. And it's a patient group that I don't see very often, certainly as during my career and life as an offshore medic. So it's a really good opportunity. So every patient that I've seen during the course of that 10 days, I've written down, and anything that I found really interesting or challenging, then I've highlighted that to be able to reflect on and look back on. Um, Simulation and training. This weekend, again, I had the opportunity to work with some uh, local law enforcement, some police. We've been chatting online and through a colleague, and they were looking at doing some update training themselves. So, again, continued education for themselves. They're non medical people, but they want to be able to enhance their skills, which again improves their client contact. So if it enhances the service that they're providing as police officers, then obviously it's not only of a benefit to them, but a benefit to their clients. So we got together and I was actually working with them and we created various simulations and scenarios that actually benefited us both. So for myself as a paramedic and also for them as police officers. So simulation and training like that is a really good idea, and it doesn't take much to be able to put something together. Certainly, again, offshore, we've got a resusciani. It's not something to be left in a cupboard collecting dust. And I highly recommend that even as paramedics, you get Annie out of the cupboard and go through some basic life support or advanced life support scenarios, so that you, as well as your teams that you might have working with you, maintain proficiency. Peer learning is also a really good way of continuing our education. Certainly, engaging with colleagues and sharing experiences, and that could literally be over a cup of coffee, something that you can sit down and talk about. I have a colleague, Radan, and every now and then he'll call me and or he'll send me a message on Messenger and he'll say, "Hey Tim, I've got this patient. Um, he had this. I did an EKG. He had these various bloods, etc., etc. What do you think?" And we'll have a quick discussion online. And then when it gets too complicated for online, we'll give each other a call and we'll discuss a patient, which is really good way of doing it because, again, um, obviously my colleague is able to talk about it and reflect, but I'm gaining learning from him as well, and vice versa. So that's a really good thing to do. My wife calls it talking shop. But at the end of the day, talking about what you do, it's something that you're interested in. And again, you're going to benefit from that in terms of knowledge, and something that you can maybe take away and use next time if you have a patient that's similar. And of course, you're looking at technology integration as well. So, looking at the use of e learning, most certainly for myself, I do a lot of e learning and study online. There are various medical apps. Deployedmedicine.com is a perfect one that you guys could go to. It's got a really good section on videos. And whilst it may be kind of tactical medical oriented, the skills and everything that you're seeing demonstrated can be taken into a civilian environment as well. It's not just for the use for military personnel, so that's a good one to go through. Um, of course, the college provides various e-learning courses as well, and you can have a look at our edu.mt webpage, and you'll see what courses we have available. And there are virtual reality tools that you can use as well nowadays. And there are tools available where you can go through various patient simulations. Any of you that have done advanced cardiac life support, I would have thought you'd have used some kind of simulation ECG type program that you can get on a tablet, or have it on a laptop, and you can go through various cardiac arrest scenarios, and you have to choose the right drugs, diagnose the ECG rhythm, and various other things. So the use of those virtual reality tools is really good because you've got a decision making process that goes with that. So that being said, in terms of the components of CME or CPD, um, again, I mentioned earlier on about reflective practice. And for me, this has been really a really useful tool, especially again being on a master's course at this moment, where I'm really having to kind of sit down and think about the impact of what I do as a medical practitioner on my patients, as well as my impact as a leader in the medical field. And in terms of um, reflective practice is the systemic process of self evaluation and a critical analysis of one's own experiences, decisions, and actions. And what I'm going to do is we'll look kind of how reflective practice encourages medical professionals to learn from successes, but also from our mistakes. And there's kind of a saying, learn by your mistakes. Ideally, we don't want to make them, but we're only human, and it's inevitable that it's going to happen. And in doing so, it will lead to continuous improvement, and that's what we're trying to do at the end of the day. And in terms of importance of reflective practice as a tool, it's going to enhance self-awareness. So for you as an individual, it'll help you understand your personal strengths, your weaknesses, and also your biases as well. Some people might see this as a little bit of tree hugging, but again, as medical professionals, as remote healthcare practitioners, we really do need to understand what we're good at and what we're not good at. And we should play on our strengths, but also recognize our weaknesses. And in doing so, that will identify areas for improvement. And we should always be looking to improve. But of course, like I said, there's going to be biases there as well. So it might be that certain things will steer your decision making into a certain direction when that direction isn't always the best direction to be going in. Now, biases are going to come about from previous learning, but there's also cultural biases as well. There's biases that could be, part of the culture of the place that you work at. An important thing that reflective practice does is it fosters critical thinking. And certainly analyzing your clinical decisions as well as their implications. And it'll encourage adaptability as well. So adapting your practice, and that's going to be based on evolving evidence, as well as your patient's needs. And it'll strengthen your empathy as well. Now, I've always thought that to be a good medical practitioner, you need to be empathic. In other words, you need to feel some of what the patient is going through in order to understand what the patient is going through. And that will also help you understand the patient's needs, and will help you when it comes to your decision making. So you'll understand patient perspectives. It's not always about your perspective. It's about the patient's perspective. And the patient is the most important person in the room at the end of the day. And it will improve your patient, paramedic, patient doctor, patient nurse relationships. So when it comes to reflective practice, there are steps again, and we should be looking at its experience. So, we want to be able to describe a specific patient encounter or a medical situation. And that's important when we're looking to reflect. The reflection itself, where you're going to analyze the experience that you went through, the thoughts that you had, but you also need to consider things like emotions. And again, people thinking, oh my goodness, this is all about tree hugging. But this is important. How you feel during that situation, again, will influence your actions and your behavior. Of course, learning. So you need to identify lessons learned, and this is really important. Of course, new insights as well, a different perspective on how to do something or how to approach someone, or potential areas for improvement. And again, that's really important. Identifying where you can improve. So you can go away at the end of it and think, okay, if I had to encounter this kind of scenario again, how could I approach it differently? Or what could I do next time that's going to provide a better experience for the patient and a better outcome? And at the end, what you need to be doing is planning. So after all of this exercise is done, after this reflection is done, you should be developing an action plan for implementing that new knowledge for future situations. Of course, there are going to be, challenges and solutions when it comes to continued medical education, and most certainly when you're at work. And it really depends how busy you are. And I understand that, after you've had a really busy day at work, the last thing you want to do is get out textbooks when your head's, full of whatever's gone on during the course of the day, and you just want to relax. You just want to go to the gym, get rid of some of that maybe pent up frustration and some of the annoying things that have happened to you during the course of that day, and then go to bed and start again the next day. And especially if you're working in a really busy emergency medical system, finding the time and the motivation for continued education can actually be really difficult. So busy schedules can hinder participation, and really what we want to be doing is breaking down our education or our educational experience and putting it into bite-sized learning modules or flexible formats so that we can actually achieve it. There might be resource limitations as well, so limited access to training opportunities in terms of online resources or the virtual learning platforms that I mentioned earlier on. Again, I'm looking at my own experience, and certainly when I go offshore, people have an expectation that the internet is going to be, full strength. You'll have a good signal, the same as you get at home, and you'll have no access playing your videos on YouTube. And there's some great resources on YouTube in terms of, watching things. But again, bandwidth may be restricted. If you're on a ship, it may actually be only available once or twice a day, and that's restricted to literally sending emails. So whatever you have, you may need to take with you, and that could be reading material. For myself, I actually have Kindle, and I I'll download books, medical textbooks through Kindle, especially for my MSc as well. So I've got something that maybe I can read on a train, or maybe if I haven't got access to the internet, I still have a resource for learning. So lack of internet or lack of access to the internet actually is a major one when it comes to continued education nowadays. So I'm going to recommend get other materials. Don't always rely on the internet, or certainly download stuff so that you can go away and watch it or read it later. And for some professionals, and I hate to say this, but there are people out there where there's a resistance to change. They've always done what they've done the way they've done it, and they don't necessarily see why they need to change and the need for a continued education because they're doing the job every day. They see that their basic education that they've done in order to achieve their nursing degree or paramedic degree or whatever is enough. And all they really need to do is keep doing what they're doing in terms of their clinical practice, and they don't really need to do any more. So some professionals may resist adopting new practices, and really our job, and certainly someone like myself, which is why I'm talking about this on this podcast, is emphasize the benefits. And what we need to be doing is creating a supportive learning culture for our medical colleagues. So again, any guys out there that are interested in CME or CPD and enhancing their current knowledge, please send me an email. I'm more than happy to talk about it. And of course, I'm going to encourage you to come and join one of our courses as well. And you can do those courses anytime. You don't have to wait to be sent on a refresher course by your company. And a lot of the guys that I meet here in the Czech Republic as well, medics, military guys, and law enforcement that I work with, they have to pay. So they're doing this, out of their own pocket, which I think is really good because they're not, expecting someone else to pay. They're doing it because they enjoy the job, and they get a lot out of the service that they are able to provide, and they think that it's really important to enhance their medical skills. And if that means paying for it privately, then they're more than prepared to do that. And I think that's a really good attitude to have, especially when it comes to improving your client contact. But whatever form of reflective practice that you're going to do, or whatever form of CME or CPD you're going to do, you need to set clear goals. So whatever learning objectives you have, and areas for improvement, make sure you've got clear goals. You know where you want to go. So for myself, most recently, I'm studying leadership, and how that affects, um, client and hospital-based services. So I've got a book here. This is Leadership Theory and Practice, um, Peter Northhouse, and basically I'm reading this. This is my go-to at the moment. I'm currently on chapter 15, Culture and Leadership, and this is looking at things from a global perspective, but it's really important for me, if I want to leave my clinical practice here in the Czech Republic or offshore in the UK, and work somewhere like KCMC in Tanzania. And I need to understand, the cultural differences and how things maybe are different, or how they're looked at in other countries. So make sure you've got good, clear goals, but develop a learning plan, and identify relevant activities, and make sure you make time for it. And this is it. It's about planning. We say preparation and planning prevents poor performance, and that adage, or that old adage, that works every time when it comes to something like this. You've got to make time, and you've got to set aside time for this. Of course, you also need to embrace technology. So if you're not, really good with a laptop or really good with a computer, this is what you need to be looking at. I mean, I'm picking up my mobile phone now, and there are some great downloads that you can get on a mobile phone. I'm just kind of having a scroll through now. So I'm on an Android phone. So obviously I want to be looking at whereas the app, of course, now I can't find it. It's typical when you're looking for something. But essentially, you can do a search for various medical apps. Deployed medicine.com is one of them, and you can get that on mobile as well. So not only can you get things on laptop, I think most people have got a mobile device now, and you can watch things, or you can read something as you're traveling or doing whatever you're doing. Embrace technology. Collaborate and share. So engage in peer discussions and knowledge sharing. Rodri Jordan, if you're out there, hopefully you're listening in. Myself and Rod, we're currently on the masters together, and we're firing things backwards and forwards to each other about various topics. I've sent him information on some of the stuff that I've been writing about and researching, and Rod's sent stuff back, and it's really good to have someone that you can kind of go backwards and forwards with, and share the knowledge and the information that you found. And it might be that you're going in one direction, somebody's going in a different direction to you, and they've actually got something that's relevant to what you're working on. I'm terrible for disappearing down the rabbit hole, and then I can kind of get lost in my research. So having discussions with within your peer group can help keep you grounded, moving in the right direction. So, like I said, I've been talking about reflective practice, and one of the tools that we use at the college, after students have done modules, or after they've done their clinical placements at KCMC or wherever, we encourage them to do a Gibbs reflective cycle paper. And I'm not sure how familiar you guys are with the Gibbs reflective practice system, but it's a really useful tool. So what I'm going to do is I'm going to take you through a paper that I wrote that was a reflective practice, but I'll take you through the stages of the Gibbs reflective cycle. And essentially it goes in a circle. So stage one is the description. My stimulant for this particular reflection was a feeling of deja vu I had when I first taught prolonged field care. Now, I was a subject matter expert, so an SME, on the NATO Special Operations Combat Medic course that was in Fullendorf in Germany. And this was actually in 2017. And this was over the course of several months. And after a briefing by the course leader, we were told to draw on past cases and experience when we were conducting patient care scenarios. So prolonged field care was being taught, certainly at that time, so this was 2017, as a new subject on the NATO Special Operations Combat Medic course. And certainly for myself, as a remote healthcare practitioner that's been working in remote healthcare for a significant number of years, I remember thinking, yeah, I can do this because this is something I do all the time. So I felt comfortable and confident that the concept, certainly for me, was nothing new in terms of my training experience. I come from a military background. I was a British Army combat medic. And like I said, I've been working as a remote healthcare practitioner for a number of years now. So prolonged field care focuses on what we can describe as nursing care. So for me, as an Army CMT, I trained to Class 1s. I did that in the late 80s. And at the time, we followed a 3-year qualification program that focused a lot on basic nursing care skills and in hospital care. So it wasn't just immediate care skills and pre-hospital care. We did a lot of nursing and in-hospital care. So after my medical service, or sorry, should I say my military service, I've worked in many resource-poor environments in remote locations, and I understand that it can often take hours or days to be able to repatriate a patient to a high level of medical care. And like I said, I've been doing this for over 30 years. So in terms of leading up to being an instructor at the International Special Training Centre in Fullendorf, I'd already undertaken the NATO Special Forces medical simulation and instructors course in Belgium at the SHAPE headquarters. And I'd done that in 2015. And I soon realized that the teachings on that course, especially what we call the ADDI process, so assess, design, implement, evaluate, would be needed when I was told that I would be presenting as an SME during the NSOCOM course. So that's the background to this reflection. So the second stage on the Gibbs cycle was feelings and thoughts. So these are the thoughts that I wrote down. So I was surprised that this was being taught as a new subject, PFC, when I had thought that we'd been doing what was described as PFC for years. But I soon realized that in terms of military doctrine, there was a newly realized need to train Special Forces medics to a higher standard and ensure that they had a far greater range of knowledge and expertise so that they could cope better in resource-poor environments without the need for direct recourse to other medical staff or experts and hold a patient for a period up to and greater than 36 hours. So I was not expecting to write down my own lessons and scenarios prior to joining this course. I had assumed that all course materials would already have been created and be ready for me to read through and deliver. But I soon understood that this is how things were taught within Special Forces medical community to ensure all teachings are relevant. So they will bring in subject matter experts who are up to date, who are doing this job at this moment in time. So why keep rewriting things or have one standard way of teaching which constantly needs to be updated when we can just bring in the up-to-date information at the time? So again, this method ensured all teachings were relevant, they were as up-to-date as they could be, and they were taught by current practitioners of the subject. So like I said, I ended up having to write my own lesson and scenario plans. So the third stage of reflection is evaluation. So the NSOCOM students, they're following a 22-week program that included various medical subjects from pre-hospital care, advanced trauma life support, tropical medicine, rescue, and various other subjects. So I was joining the course approximately halfway through, where the students had studied all of the pre-hospital care and prolonged field care theory, but they needed to put it into practice. So I would need to deliver and demonstrate various intensive care nursing skills that included, but not limited to, the use of drugs, drug delivery systems, pumps, urinary catheterization, both male and female, IV fluid warming systems, chest drain insertion and management, wound cleaning and debridement, suturing and taking and trending vital signs. Now, I felt slightly unnerved about this responsibility being placed upon me, and in some respects, I felt not ready for the task. Now, I'd been recommended and I'd accepted the job, so I'd accepted to do this tasking, and of course, I didn't want to let anybody down. But I would need to draw upon all of my experience as both a practitioner and a trainer or an educator to do the best that I possibly could. Now, very little pre-course information was provided to me prior to joining the course. I was expected to find a way and make it happen. So any of you guys out there that come from a special operations background, you'll know that this is a soft mantra. And of course, I would then need to default back to my military training to be able to achieve this. You're not always going to have everything you need. You're not always going to have the solutions, but you should have the know-how to know where to go and know where to look to be able to put these things together, find a way and make it happen. So the fourth stage on reflection is analysis. So this is where I analyze what was happening and what I needed to do on this course. So, as I mentioned, in order to understand the PFC concept, you must teach what is current in terms of doctrine and teach what you know works. So, you must also understand what a patient needs in terms of longer patient care, especially when it comes to how the body works and what must happen as a result of metabolism, respiration, nutrition, and hydration. For me, I felt I was being tested by the core and SOCOM staff. So these guys are full-time military SOF medics and practitioners. For myself, I was retired ex-military, having worked in a SOF background post my military service when I came out of the British Army. I became a military advisor to the US military, and I worked with SOF during that period of time, and hence going to SHAPE to do my SOF medical instructors course. But this could also have been my self-doubt in terms of my own capabilities, as the skills required are those that are not practiced by the SOCOM or the remote healthcare practitioner on a regular basis. So even myself, I'm not necessarily doing things every day. So unless you work consistently in a hospital-based environment, which is where most of the doctors did, then you've really going to be tested. And I felt that I was being tested. I was having to earn my place as an instructor or as an educator on this particular course. And I think it's important to have this feeling of self-doubt, most certainly when working as a remote healthcare practitioner, as it helps to ensure that you make the effort for self-study and personal development. And I mentioned this earlier on in the podcast. Now, I completely understand the concept of make it happen in military terms. In the British Army, I often had to buy my own kit or come up with some way of MacGyvering equipment or training and learned, due to necessity, the need to be flexible and come up with a working solution at short notice. However, you could also argue that this is due to a lack of understanding and preparation, and it would not be acceptable and fall short of the standard of course preparation expected when I was running a civilian medical training program. So military and civilian, training is different. And there's an expectation on a military program is that you come in as the subject matter expert. You are given a subject, and the expectation is that you will deliver it. You don't need to be handed pieces of paper. You don't need to be handed PowerPoint presentations. You don't need to be handed lesson plans. You should already have that knowledge and that information. And the thing is, what they don't want is somebody being bored to death in front of a PowerPoint presentation for several hours. What they want is you to be able to talk, demonstrate, and then the students practice. And it's very intense for these guys on the NSOCOM course. And it's also intense for the instructors too. So as a teacher and a practitioner of remote healthcare, I am familiar with how to research medical subjects, and I have my own portfolio of references and texts to help me prepare lessons. So again, I've got a data bank that I've made up during the course of my career that I can then go back on and I can think, okay, there's something I need to use, whether that's for me right now personally to enhance my medical knowledge, or to understand my shortfalls, but I can use this information to help other people as well. So I would highly recommend that you keep and you document all of the training that you do, especially when it comes to the articles and the text that you read. Thankfully, on this particular course, I brought several books with me that included Anatomy and Physiology for Nurses by Sheila Jackson, if you want to go and look that one up. And that's a well-thumbed copy that I've got. Also, I had a copy of the U.S. Army Special Operations Medical Handbook. And you should be able to find that one on Amazon as well. If you don't know, again, send me an email and I'll send you the ISBN for that. I travel everywhere with my laptop. So I've got some basic presentation materials on that and on various thumb drives that I can utilize to deliver effective theoretical training and practical training. And I'll take that with me when I go on a job somewhere. I'll get some guys together, usually the catering team or other members of my crew, and we'll go through some medical training that's going to enhance our performance when it comes to responding to a medical emergency on our ship or on our oil rig. So then we've got stage 5, which is your conclusion. What are you trying to get out of this reflection? Preparation and planning prevents poor performance. So I wrote this down, and I've already mentioned this earlier on. And that's the main conclusion I can draw from the analysis of this reflection. In order to be good at prolonged field care, you have to practice the subject matter. And in order to be good at teaching prolonged field care, you have to practice the subject matter. Teaching prolonged field care is very important, and it should be a core skill of all remote medics, so not just SOCOMs. And it's not something that is taught on the UK HSE Offshore Medics course. So again, for me, I'm going off to do my HSE Offshore Medic refresher course, but I know it's going to be missing certain elements, and these are going to be things that I need to read up on before I come back to doing my my next refresher. So these are some of the goals that I'm going to set for myself. As a remote healthcare practitioner no longer in the military, I'm used to sitting on patients for several hours or days due to weather delays, especially if I'm working on an oil rig or a ship. And you have to be able to manage all aspects of patient care, which includes keeping them clean, warm, dry, hydrated, fed, and toileted, as well as managing their medical condition. So that said, you still need to stay well read and prepared to deal with whatever the patient and environment is going to throw at you. So it's worth reflecting on those what-if scenarios. Now, at the time, I was not wholly familiar with the College of Remote and Offshore Medicine's handbook. So our little notebook that we can go to and we can, look at certain procedures that we might want to be able to perform. So our field guide. And it was at that time in 2017, 2018 that I first met Eric O'Kelly from the College of Remote and Offshore Medicine. And this is how my relationship started with the college. And Corom and Ebrick were teaching the tropical medicine portion of the course at that time. Obviously, now I have a copy of the Field Guide for Practitioners. And for me, this has been a fantastic tool and really useful tool, and not only during that course, but especially for me now that I'm working, offshore and as a remote healthcare practitioner. So it introduced me to terms like Marsh Pulse, CPRO, Beast, and HipMap. The final stage of your reflection should be an action plan. So my action plan for my time that was spent at Fullendorf, or at that particular time, was read, and read some more. Practice basic nursing skills, especially those you do not do often. Conduct prolonged field care type scenarios on a regular basis. Be good at trending vital signs and recording them. Discuss prolonged field care on my next Offshore Medics refreshers course. Well, I'm going to be doing that in a few weeks' time. So I'm going to be doing this again. And this has been a really good opportunity for me, not only doing this podcast, but reading this reflective paper that I wrote, because now I can do this. It's a reminder for me to do this when I go on my next refresher. I've also completed my further medical training. I've done austere emergency care. I became an austere emergency care um, instructor, and that was one of the things that I put on this action plan. I've become a pre-hospital trauma life support instructor as well, and that keeps me up to date with my pre-hospital care side of things, and with the AEC, the prolonged fear care side of things. And also, now that I'm on the MSc, so I'm working, in more of an academic field. Um, it's helping me make myself a better medic, or certainly the medic that I want to be. And it's helping to dispel that feeling of doubt that I had kind of earlier on in this reflection. So hopefully that's helped to explain reflective practice. And I've kind of done that practically because that's something I wrote about myself. And it highlights the steps that you need to take during the reflective process and the subsequent actions that were implemented by me. So CPD, CME, reflective practice. It's really important to do this because it will help maintain excellence when it comes to medical practice, not just you, but also that of our colleagues. Ongoing learning. We should be lifelong students as medical practitioners, but be critical. Don't be afraid to self-assess, and doing so is essential for providing the best possible patient care, and most certainly staying at the forefront of medical advancements. And for us at the College of Remote and Offshore Medicine, that's most certainly one of our goals. That's what we want as an organization, and we want our students to do as well. Encourage colleagues. So this is not just for yourselves. When you finish listening to this podcast, don't be afraid to go out there and tell as many people as you know to embrace CME or CPD, as well as reflective practice, as an integral part of yours and their professional journey. So hopefully, I've given you a bit of information there when it comes to CPD and CME. I've given you a few pointers on how to go about it, as well as a few places that you could go. So, as I said, there's deployed medicine. Obviously, there's the College of Remote and Offshore Medicine. Have a look at our webpage. Look at some of the courses that we do, and these are not just in classroom courses. There are quite a few options now in terms of the online learning that you can get your CME points or your CPD points for. I'm registered with the Healthcare Professions Council and in the UK, and it is necessary for me, in order to maintain my paramedic registration in the UK, to maintain a record of my continued professional development. And the onus is on me to do that. I put an awful lot of effort into getting my state registration as a paramedic, and I really don't want to lose it. So I make sure that on an annual basis, or as soon as I've done it, I'm keeping a resume, I'm keeping a curriculum vitae of all of the things that I've done. That could be reading articles, that could be doing a quick online course in data management. These things are important, most certainly, if when it comes to maintaining medical records. Every little bit of medical practice, anything that's relevant, I make notes and I write it down. I'm actually looking across from my desk in my office, and I've got a big pile of what I call my CPD pile, and anything and everything that I've done. So this last weekend, I've put the schedule there from the program that I ran for the police officers for the 2 days, and that includes a record of the scenarios that we did, and that's all evidence that I can provide to the HCPC to demonstrate my continued medical education. I do it, and I hope you guys do the same. Again, if you've got any questions, you can contact me at t.cranton@corom.edu.mt. Drop me an email, and I will do my best to answer. I hope you've enjoyed the podcast, and I look forward to speaking to you again another time. Thank you.
This has been a presentation from the College of Remote and Offshore Medicine Foundation. If you would like to earn CPD credit for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credits, free access to the virtual field guide, and discounts on our e-learning courses. You can join the team on the college website, which is Corom, C-O-R-O-M, corom.org.